What do you mean by hypoxia? In simple terms, you give oxygen to a cell, it can generate its own ATP, whereas when the cell does not get oxygen, it will undergo something known as hypoxia, which will cause cell injury. Now, there are three ways that a cell can undergo hypoxia. The first has to do with blood, second has to do with the blood's oxygen carrying capacity, and the third, of course, oxygen. Now, if you don't get blood to the cell, the term used would be ischemia. If you don't get enough oxygen, that is, the partial pressure of oxygen is low, you'll use the term hypoxemia. Now, coming to the main part of the video, that is the low oxygen carrying capacity. Now, here's a schematic diagram of hemoglobin for you. These four circular structures are heme, which contains iron in the Fe2 plus state. You need to remember that, right? And these big four more structures that I'm drawing, these are the globin chains. Alpha 2 beta 2 is the adult hemoglobin. And the oxygen in the blood readily binds to the heme molecules. Now I'll be discussing three major causes of decreased oxygen carrying capacity, and we'll discuss the latter two in detail. So now that we know hemoglobin carries oxygen, what would happen if we have low hemoglobin? Now that would be anemia. Now we know in anemia there is enough oxygen, right? So the PaO2, that is the partial pressure of oxygen, would be normal, and whatever little hemoglobin we have, it is well saturated. So the saturation would be normal too. So coming to the main part. Now whatever smoke that I'm making here from the car fumes or fire, there is one particular molecule that comes out, that is carbon monoxide. Now this carbon monoxide molecule, now what happens is this carbon monoxide molecule has a much stronger affinity to the Fe2 plus and heme, thereby it displaces oxygen and causes hypoxia. Now, as you can see in this scenario, we have enough oxygen in the blood. So the partial pressure of oxygen is totally normal. But the saturation, that is the attachment of oxygen to the hemoglobin molecule, has reduced because the carbon monoxide has displaced it. And therefore, the saturation would go down. Now coming to the third cause, and that is methemoglobinemia. Now what happens in methemoglobinemia? Can you see those Fe2 plus molecules? Yes, these molecules get oxidized to Fe3 plus. But oxygen molecules can only bind to Fe2+, hence under oxidant stress, methemoglobinemia occurs where the partial pressure of oxygen might be normal, but the oxygen in the blood cannot attach to hemoglobin, and hence the saturation decreases in methemoglobinemia too. Thank you so much for watching. There's a lot more to be read in this topic, but this is just a brief overview for you to go through whenever you want to revise this. And I would love for you to suggest me more topics that you would like me to cover. And subscribe if you like it. Go follow my page. Thank you so much.